What questions or problems are you working to solve?
When I think about the grandest challenge in my industry, in the healthcare industry, I think about our people. There are so many factors that are pushing on our healthcare workforce, and I want there selfishly to be people to take care of me when I'm in need of healthcare services. And so there are a couple of things that I'm thinking about, big picture things that I'm trying to solve. But the most critical one, and really the core of it, is how can we rehumanize the healthcare profession? So at its very core, healthcare is humans working with humans to heal humans. And yet the way that we approach our humans in many ways is dehumanizing. The way we talk about our humans, the working conditions that we provide for them. And so my big ambition is to try to understand, how do we stop breaking our humans and how do we fix them? And I think so much of that starts with rehumanizing the healthcare worker and seeing this as a normal human person that wants things that normal human people want at work, not some, superpower, superhuman person that can withstand these conditions indefinitely. But we have a lot of work to do to understand the scope of the problem, and more importantly, what solutions work and how do we fix it. There are so many industry pressures that push on the healthcare workforce and on the industry in general, in terms of declining reimbursement, increasing disease burden, and an aging population. So this is not an easy problem to solve. It's very multifaceted. But if we don't do this, I think our ability to make a positive difference in the lives of anyone in our community will be severely hampered. And so that's what I'm trying to do. I think something else that's really important is not just admiring the problem. We do a really good job in healthcare of running around and saying, oh my gosh, everything is broken. And it's a hyper turbulent environment and it's a crisis. And so, we've had 40 years of crises in healthcare. This is nothing new. I think the other really important thing is to try to understand what is the solution. And so I also experiment with different types of things within organizations, and then I test them as rigorously as possible to understand if what we're doing is making a difference in the outcomes of interest, whether that's feelings of psychological safety and belonging, well-being, burnout, etc. And so I think not just focusing on the problem, although characterizing it is important. We can't solve it if we don't know what we're up against, but also trying to test solutions and push for, okay, we know this is broken, but here's what we can do to fix it. One of the things I love about healthcare is that the industry is so lean. There's very little wiggle room for frivolity, if you will. And so we have to focus our efforts and resources on things that will work. We don't always have the luxury of experimenting or chasing money after, throwing money after things that are likely to be ineffective. And so helping leaders and decision makers identify those things is really important to me.
Why have you chosen to pursue this question or problem?
So I actually started my career in oil and gas, working in finance. And during that time, I learned a lot about the refining process, which is largely useless knowledge now. They don't really ask a lot of questions at trivia night or on Jeopardy about, isoparaffins. But what I learned about the refinery when I was auditing one summer was that it is a highly complex system full of combustible fluid, that if any piece breaks or malfunctions, the entire thing can explode. It costs tens of millions of dollars and people die. And so there's a very rigid approach to making sure that doesn't happen, including routine maintenance and scheduled downtime. It's a high reliability organization. So then when I got into healthcare, I expected to see the exact same thing. And instead, what I found was that we have a highly complex system. And if a part of that system, namely the humans, break down, patient harm can occur, damage can occur, it can cause tens of millions of dollars and people get hurt. And yet, instead of taking that same approach to routine maintenance and scheduled downtime of our human assets, we tend to wait until people burn out and then they leave, and then we try to hire more people. And so it really surprised me, coming from a very capital intensive industry that's not really known for its altruism, into this altruistic workplace and seeing that people really are receiving treatment that I would not expect of machinery. And yet we refer to them as machines. We say things like FTEs and turnover rate and the people that, load the trucks or make the sausage. I mean, we're not referring to people in human terms. Physicians are expected to see a patient every 12 to 15 minutes. for the entire day. We don't schedule time to go to the bathroom. And just this very strange way of thinking about humans at work. And so on one hand, intellectually, that interests me. On the other hand, I see the experience these people are having. I hear about physician suicide, nurse suicide, people enduring this. And I feel like, gosh, these are people who have dedicated their entire lives to serving our community. We have to be doing something for them, and we have to advocate for them in a way that decision makers will listen. And I think that message, that communication style typically is through data, rigorous analysis, and really understanding the nuances and complexity of the problem. And then on a personal level, I have many people in my family who are healthcare workers, and I've seen firsthand the toll that the work can take on you emotionally. You're dealing with really the most intense kinds of human suffering, and you need emotional capacity and reserves to absorb the inherent difficulties of the work. And so if we're not designing systems that allow for that, I just don't see it as sustainable. And that scares me. It scares me not only for the people that I love in my community, but it scares me for my children. I want us to have a healthy and robust healthcare workforce to be able to take care of all of us. And I want those people to be operating at their very best. And we know that when the brain is under chronic stress, it's not operating at its very best. And so that's really given me a deep passion around this issue.
As individuals and collectively as a society, what can we do to help answer the questions or solve these problems?
I think we all have a role to play here. First of all, in many cities, many places across the United States, the healthcare employers are the largest employers in those communities. It takes a lot of hands to do the work. It's one of the most human of industries. And so you are likely at the grocery store, at the gas station, and at the restaurant with a healthcare worker at any given time. And so treating those people with respect and kindness, I think in general, treating everyone around you with respect and kindness helps them preserve some of that capacity to be able to do the important life-saving work that they do. I think to get more specific, the last couple of years have really been a challenge for healthcare workers. There's been a level of mistrust that I think many clinicians have not experienced before, mistrust from their patients. And unfortunately, we're also seeing a rise in violence towards healthcare workers. In our own research, we've seen that rates of violence and mistreatment towards healthcare workers have doubled from 2021 to 2022. People are being physically assaulted at work, they're being verbally assaulted at work. So it's already a hard job. There are so many things that are making the delivery of care difficult, whether it's overcrowding in the emergency department or people catching up on the care that they missed during the pandemic, or even low staffing, which is making it hard to keep enough beds open. And so it's understandable that patients and that members of the community are frustrated and angry when they're interacting with the system. But for that individual physician or nurse or patient care technician, or even, food service worker, guest service worker, for them, they don't need to be the target of the hostility. And if we don't help these people avoid situations that cause physical, emotional, and mental harm, they're not going to be there to take care of us. And so I think the most important thing that we can do is to carry every interaction that we have with the healthcare space with civility and kindness. It doesn't mean you can't be upset about a bad experience, but recognizing that these are human people that are doing their best in a very difficult situation to try to care for you, the stranger. And so I think giving them that respect, that kindness, and that support as a community is critically important. I think the other thing that's important to think about is for the leaders who may be listening. So many things happened to our healthcare workforce that were beyond our control, whether that was COVID or the reaction of our communities. But there are so many things that as leaders and even coworkers are within our control that can be tremendously protective. So we've been looking at PTSD symptoms in healthcare workers, and one of the most important protective factors is respect and recognition. And so that's something that I can do personally for a colleague, is to show them respect and give them recognition for a job well done. That's something that I can do as a leader. And so sometimes these problems feel so big that it allows people to get in a pattern of thinking of, okay, this problem is so big, I can't do anything personally to solve it, or nothing's going to change until these people up there make this change. But I think what we continue to see again and again in the research is that that small microcosm of the team and the peers that you have around you have a tremendous ability to impact your experience. And so my encouragement to individuals working in healthcare is, if you don't have the leadership that you want, or you don't have the society that you want, or the support that you want at this level, be that for somebody else at the smaller team level. And if you do that, you could save a life.